Hi everyone, welcome to researchmd.com. We got a great topic today. We're going to talk about another statistical term, statistical hypothesis. So again, my name is Pramil. Cheriyath. I'm a director of research. I teach medical students and residents, also director of program, internal medicine and transitional residency, and I'm assistant professor of medicine. So let's get into our subject. So what is our definition of hypothesis? An idea that's proposed, right? And before you do a study, you proposing your idea, that an argument so that can be tested. Then you have to test it if it is true or not, right? First you come with an idea, then you have to test it. Is it become true, or is it really true or not, okay? The statistical hypothesis is an assumption about a population parameter. The assumption may be or may not be true, which we don't know. We're going to find out that kind of later on. For instance, the statement that a population mean is equal to 10, example of statistical hypothesis. Then you have to conduct this statistical experiment, right? First we come up with the hypothesis, and then we're going to check it, is it true or not, okay? Based on our experiment. So what is the purpose? Purpose of the hypothesis testing is test whether null hypothesis can be rejected or approved. Null hypothesis means there is no difference, okay? So the hypothesis testing is you checking on the null hypothesis, can you reject it or is it approved? If the null hypothesis is rejected, then the research hypothesis can be accepted. Always remember that. Null means no difference, zero difference, okay? Now, what are the types? There's null hypothesis and alternating hypothesis. You can call H0 and H1. No, so null hypothesis, no difference, no relationship, okay? There's no association between the disease and risk factor if you're suspecting a disease. Alternating hypothesis is the hypothesis, some difference. There is a relationship. Okay, that's pretty much what we're trying to say. Power of hypothesis testing. The power of hypothesis testing is a measure how effective the test in identifying the difference in population if such a difference exists. It's the probability of rejecting null hypothesis when it is false. Remember, it's the probability of rejecting null hypothesis when it is false. Okay, so let's look at p-value. What is p-value? It's a measure of probability that an observed difference that could have occurred just by random chance. Okay, that is the definition. A p-value is used in hypothesis testing to help you support. Based on your p-value, you can reject the null hypothesis and you can support or reject the null hypothesis. Okay, lower the p-value is better, greater the statistical significance. We have usually used the p-value like less than 0.05, right, the standard. For example, if the p-value less is 0.05, it indicates that if the null hypothesis were indeed true, then there would be only 5 in 100 chance your result could be random, okay, happen by chance. Remember that. So what are the steps in hypothesis testing? One, specify the null hypothesis, and then you have to specify the alternate hypothesis and set the significant levels alpha and calculate the test statistics and corresponding p-value, and then finally you come with the drawing and conclusion. Thank you so much for watching. We'll be back with another presentation soon. Thank you.